Welcome to lesson 4.2 on pulse. What creates the pulse? That is when the left ventricle of the heart contracts and blood is forced into the aorta, which is the largest artery in the body, which is already filled with blood, and then it expands to accept blood from the left ventricle. This creates a pulsating wave that travels through the arteries of the body, and the wave is known as the pulse. Pulse rate is the number of heartbeats in 1 minute. So we measure that in beats per minute or BPM. So the heart rate is determined by taking the pulse rate. Normal pulse rates vary widely by age group. The normal healthy adult range is 60 to 100 beats per minute. So make sure you memorize that, with the average falling usually between 70 to 80. Tachycardia is an abnormally fast heart rate, so anything more than 100 beats per minute. And bradycardia is an abnormally slow heart rate, so anything below 60 beats per minute is considered bradycardia. The pulse rhythm is the interval between heartbeats. A normal rhythm would have the same interval between beats, so an equal amount of time. Dysrhythmia or arrhythmia is when there are unequal or irregular intervals between the beats. And if that's the case, the provider may order additional tests, such as checking an apical to radial pulse, an electrocardiogram or EKG, or a Holter monitor, which is a longer EKG recording. The pulse volume is the strength of the heartbeat. So this is the amount of blood pumped into the aorta by each contraction. The volume should remain constant. If it's strong, the pulse will feel normal and full. Thready is when the pulse feels weak, and bounding is when the pulse feels very strong and very full. Factors that affect the pulse rate: one is age. As age increases, the pulse rate decreases. So children have a much faster pulse rate than adults. Gender: women typically have faster pulse rates. Physical activity: obviously when you're exercising, that increases the pulse rate. And emotional states can also increase pulse rate temporarily, such as feelings of anxiety, fear, excitement, or anger. Metabolism: an increased body metabolism increases the pulse rate. So example, during pregnancy, the mother's pulse rate is usually much faster than normal when not pregnant. Fever can increase the pulse, and physical fitness can actually often decrease the pulse. So somebody who's extremely physically fit or a high-level athlete will have a much lower resting heart rate. Medications can increase or decrease pulse rate, sometimes on purpose as the desired effect, or sometimes there are just side effects of a medication that can do that. So the table 4.4 should be in your textbook, has the pulse rates of various age groups. Infant, which is birth to 1 year, is 120 to 160. Toddlers are 90 to 140. Preschool children, 80 to 110. School age child, 75 to 105. So you can see how they're getting lower as the child ages. And then adolescents are the same as adults, so 60 to 100. And then after somebody turns 60, it tends to get lower, 67 to 80. And then, as I said, well-trained athletes, you'll often see them down in the 40s. So anything 40 to 60, which would be considered bradycardic, but for them, that's their normal resting heart rate. But for our purposes, we're going to focus on memorizing the normal adult rate, which is 60 to 100. So a pulse can be measured usually typically by palpation at any pulse site, except for at the apical site, we use a stethoscope to listen to the pulse. And palpate means to touch or feel. So to palpate a pulse, we apply a moderate pressure with the pads of our 2 to 3 middle fingers. Using excessive pressure can obstruct the pulse. So if you push too hard, then you won't be able to feel it at all. And too little pressure, you also may not be able to feel it. And we don't ever want to use our thumb when we're checking a pulse, because our thumb tends to have our own pulse in it, and it can be hard to differentiate between ours and our patients. The pulse is felt most strongly when a superficial artery is held against a firm tissue, such as a bone. So there's many, many locations on the body that can be used to take a pulse. And we'll look at all of them individually. Radial, apical, brachial, ulnar, temporal, carotid, femoral, popliteal, posterior tibial, and dorsalis pedis. So the radial artery is the most common site used, and it's on the wrist, just under the thumb, so on the radius side of the arm, located in the groove. It's easily accessible, shouldn't cause any discomfort to the patient as long as you're not pushing too hard on there. And sometimes people use this to monitor their own heart rate as well. The apical pulse is at the apex of the heart, which is at the bottom. And this is a much stronger beat there and can be easily heard as opposed to other pulse sites because it's the strongest right there at the heart. And you can take this if you're having any difficulty feeling the radial pulse. And also if the pulse is abnormally slow or also rapid, it can help you get a better count. And we usually use this for infants and children up to 3 years old because the other sites are difficult to palpate on small children. So this is the one that we use a stethoscope for to listen. The chest piece of the stethoscope is placed over the apex of the heart, which is the very bottom point. And you'll usually find that in the 5th intercostal space. So that would be just below the 5th rib is the intercostal space in between rib 5 and rib 6. On the stethoscope, you'll notice 2 chest pieces. The large one is called the diaphragm, and the small one on the opposite side is called the bell. If you have both types, you can actually rotate it, grasp the tubing, and then you can turn the chest piece, and whichever one is facing down is the one that is in the on position. So you want to make sure that you have it on for the side that you want to use, the correct chest piece. Otherwise, you will not be able to hear anything. And we'll look at that in the lab this week. The stethoscope is our instrument for amplifying and hearing sounds produced by the body. And it has earpieces, binaural side pieces, tubing, and then the chest piece. You're always going to make sure that you turn the earpieces forward so that you can hear the sounds. So typically they tend to have an angling to them. And so you want to make sure you position them forward in your ears because this follows the direction of the ear canal. If you have them facing backward, you probably won't be able to hear anything. The brachial pulse on the brachial artery is located in the antecubital space at the front of the elbow, and it's always in the medial aspect of the arm. Okay, so that means towards the medium or towards the middle, right? And this is the one we usually use to take blood pressure. The ulnar pulse is on the pinky side of the wrist, so that would be opposite from the radial artery. And typically it's not as strong, so a provider might use it to assess the circulation to the hand, but it's not going to be as good for being able to get the pulse rate. The temporal pulse is in front of the ear, just below eye level. And you can use this with some other pulse sites, such as the radial is not accessible. And it's easy to access in children. Carotid is on the anterior side of the neck, slightly to one side of the midline. So the midline would be from the ear straight down. So it's just a little bit forward of that. This is a really great site to find quickly. Typically, you'll see this used in situations of where we're using CPR because it's very easy to get to. So yeah, in adults during cardiac arrest, you can use it to measure in children, also monitoring pulse during exercise. But this one you have to be careful with because it can be uncomfortable if you're pushing on the neck there. The femoral pulse is in the middle of the groin where the femoral artery is. And this is used to measure in infants, children, and you could also use it in adults during cardiac arrest. But typically, this isn't something you'd be doing on an adult because it's in kind of a private area in the groin. And so a provider would definitely use this to assess circulation, though, in the lower leg. They're concerned that there's a blockage in an artery. The popliteal pulse is at the back of the knee, and it's felt most easily when the knee is slightly flexed. And you can use this to measure blood pressure when the brachial is not accessible and also to assess circulation to the lower leg. The posterior tibial, or you'll often hear this referred to as PT, is in the inner ankle, just posterior to the ankle bone, right there. And this would just be used to assess circulation to the foot. The dorsalis pedis is on the upper surface of the foot between the first and second metatarsals, so the big toe and the next one over, and again, used to assess circulation to the foot. When we're charting and taking it, the pulse, we're going to do typically for 30 seconds. So you'll find the pulse and begin counting and time it for 30 seconds. And then whatever number you get, you're going to multiply by 2 so that we know what the BPM is, the beats per minute, for 60 seconds. So you will always get an even number. No matter if you get an odd number for 30 seconds, anytime you multiply that by 2, it will turn into an even number. So if we're taking a manual pulse, you should never be recording an odd number. Otherwise, we know we did something wrong there. If the patient has an arrhythmia, if it is not regular, then we'll count the pulse rate for 60 seconds. And then in that case, you might get an odd number because it's exact. You're going to make sure you record any abnormalities in the rhythm or the volume. A normal pulse would be recorded as regular and strong, or even and regular. Sometimes you'll hear the term RRR, regular rate and rhythm. And that concludes lesson 4.2.